The title of our presentation is Cognitive Theory's Role in Diverse Systems. The students who contributed to this presentation are Angela Wade, Catherine Lee, Michelle Greenwood, and Sarah McDonald. Cognitive theory is a mid-level theory that can be practiced in a variety of settings. Cognitive theory has been proven to be effective when working with a variety of mental health disorders by encouraging different thought processes. In this presentation, we'll review the basic principles, populations it's appropriate for, and any strengths or limitations that cognitive theory may have. Cognitive theory was developed by Aaron Beck in the 1960s. It's based on the notion that our emotions and moods are influenced by our perception of events or situations. There are different levels of cognitions, automatic thoughts, and cognitive schemas or core beliefs. Automatic thoughts are more surface-level cognitions and include positive or negative thoughts that run through a person's mind without any form of conscious deliberation. Cognitive schemas are a deeper level of cognition and are a person's beliefs about oneself, others, the world, and the future that are based on assumptions that influence their overall belief system and how they understand the world. So problems arise when these automatic thoughts and cognitive schemas become more negative in nature. This way of looking at the self, others, world, and future negatively unfortunately keeps a person stuck in a repetitive and vicious cycle that maintains distress and symptoms. The cost of this is that positive thoughts and positive experiences are avoided and minimized. So there are positive core beliefs, but when the negative ones are the primary focus, it tends to drown out the positive, making your own belief system being sustained and dominated by the negative ones, which keeps you stuck. Again, helping clients recognize how their perceptions influence their emotions and behaviors is the first goal of cognitive theory. The primary treatment goal for cognitive theory is not to eliminate these negative thoughts by replacing them merely with positive ones. The goal is to challenge these thoughts to identify more realistic statements. The ultimate goal for cognitive theory is for clients to become unstuck by changing their cognitive and behavioral responses to the circumstances they face so they can move forward with their lives. Cognitive therapy is a collaborative process where the therapist and client both become co-investigators, identifying mutually agreed upon goals and analyzing the client's thoughts. The client is encouraged to take a questioning stance versus simply accepting the thought or the belief. Cognitive restructuring is the process of identifying unhelpful or negative automatic thoughts and core beliefs, challenging the reality of these thoughts, and replacing them with more realistic statements. By examining evidence for and against a maladaptive thought or belief, hopefully the client can identify a new, more realistic statement which can support him moving forward in his life. One example of a tool which helps the client with cognitive restructuring is a thought record. Using a thought record, one can identify the thoughts, examine the evidence for and against the thoughts, and develop an alternative, more realistic thought. But they also can recognize any change in their mood after challenging the negative thought or belief. According to Cooper and Lesser, cognitive theory identifies that the way people think determines how people feel and how they behave. There's a constant connection to the thought, so it's important to help clients identify inaccurate perceptions that negatively affect feelings and behaviors. Cooper and Lesser discuss the appropriate candidates for cognitive theory as those who are good planners, conscientious about carrying out responsibilities, and well organized. These clients are predicted to have successful outcomes with cognitive therapy rather than clients who have unyielding thought patterns. Cognitive theory can be utilized across a wide range of practice settings and is often used in brief intervention practice. Examples of these settings include social workers working with students experiencing social problems in school, social workers in hospice care working with patients and their families for end-of-life treatment, in a therapist's office for grief counseling, and facilitation in small groups such as anger management. Cognitive theory can be used in many practices in which the thought process needs to be identified as an influence to behavior. Cognitive therapy has been widely used throughout social work. Many have found this approach effective in encouraging positive behavior. According to Beck and Fernandez, one of the strongest benefits of choosing cognitive therapy is that it has been established through extensive research as evidence-based practice for anger management, depression, and other disorders. Another strength of cognitive therapy is that it's shown positive effects for children, adolescents, young adults, middle-aged, and older adults alike. Cognitive and behavioral theories also offer both an explanation and corresponding intervention for application with various client groups and social problems. Langer and Leitz bring awareness to a couple of the limitations of using cognitive therapy. These limitations are a narrow focus and the perception that the social worker holds authority over the client. These are important limitations to consider when working with individuals with multiple layers of trauma in adolescence. Cognitive therapy focuses narrowly on the person themselves, their current thoughts and emotions, and how those affect behaviors. This approach can be problematic. Many of the clients that social workers encounter have multiple areas of needs that often stem from family dynamics and environmental stimulus. Cognitive therapy lacks the ability to influence or impact these systems. One of social work's most valued quality is that it looks at the person and environment perspective. Social workers are required to take into account the whole person. This becomes important when treating adolescents or children. For this population, their environment and external influences are ever-changing. Without considering the support of family, friends, and structure of school, the success of cognitive therapy may be nominal. Cognitive therapy is helpful in changing the negative thought patterns, distorted beliefs, and the behaviors that reinforce these beliefs or thoughts. Social workers need to be aware that persons of different cultures or beliefs may perceive the intervention as authoritative or trying to impose the social worker's ideals or beliefs on the client. Cognitive therapy has been said to be Eurocentric in nature and is not considered culturally accepted in some areas of the world. Continued awareness is recommended when working with diverse populations, as the research for cultural diversity in cognitive therapy has been minimally explored. So in conclusion, cognitive theory serves as the basis for one of the most widely practiced forms of therapy. It is an evidence-based practice that helps individuals with mental illnesses such as depression, anxiety, and anger management overcome the negative thoughts or behaviors that lead to negative feelings. This type of therapy requires the client to be a willing participant in the process. It's structured, goal-oriented, and often requires homework of the client to practice these skills outside of treatment. Although this therapy can be applied in many settings, social workers need to keep in mind the instrumental role that person and environment plays in the client's overall well-being, and that not all cultures and ethnicities welcome this type of therapy. Thank you.